When Nick Guda shared his story nearly 2 months ago, he didn't expect that it would be heard around the world. His wife died by suicide after suffering more than a year from long-haul COVID symptoms. Amanda Brandeis explains how his trauma and grief is now helping others feel less alone.
The most haunting thing she said to me was, I feel like a robot that's malfunctioning. I feel like all of my systems are malfunctioning.
Heidi Ferrer made her living off words. A writer, she used them to navigate life.
She spent hours and hours and hours online interacting with other long-haul COVID sufferers and helping them.
Long haulers experience new or lingering symptoms weeks or months after recovering from COVID.
She kept voluminous daily notes in her phone about her symptoms and her condition. She almost kind of wrote us a roadmap for looking at somebody's life over a year with long-haul COVID.
Nerve pain, digestive issues, weakness, exhaustion.
She was bedridden. She couldn't walk more than a few steps. She couldn't sleep. She couldn't read a book. What's left?
Last year, she wrote, "One of the cruelest things COVID did to me was take away my ability to have dreams."
She wasn't depressed. She was brought to do this by being physically broken down piece by piece by long-haul COVID over a year. She was in excruciating physical pain every day.
Her story hit a nerve, picked up by media outlets worldwide.
I was happy to see that people were taking an interest in what happened to her, because up until now, the medical community hadn't. So.
And now the words of others who are suffering flood his inbox.
I'm so sorry about your wife, but I get it. That thought has crossed my mind too many times, and I don't want that for me either, but this is horrible.
Many say no one believes them.
I, too, am a long hauler. No one really understands me when I talk to them, mostly family members.
Firefighters, nurses, lawyers, and service members.
I'm a manager on a Navy base in the commissary. I'm so very sorry for your loss.
People desperate for answers, desperate for connection.
Nick, I'm laying in a hospital bed as I write this with many of the same symptoms as your beautiful wife, in excruciating pain for 15 months. Our stories are almost identical. And then Nick was kind enough to get back in touch with me, and we
Richard is among the hundreds who've written to Nick.
I have been admitted to the hospital, different hospitals, a total of probably more than 3 months. I've been to the emergency room probably 40 times.
While equipped with a good team of doctors, he still has few answers.
One day you might be okay, and then you might be unable to get out of bed for the next 3 or 4 days.
Struggling daily with digestive issues, food intolerance, and neurological problems.
It's absolutely debilitating.
There are a lot of people out there like her who are literally disabled right now from it. They cannot work, they cannot function, they cannot take care of themselves. We don't leave people on the battlefield in this country. We don't leave our soldiers behind. And if this is a war on COVID, what are we doing for these people?
In Los Angeles, I'm Amanda Brandeis reporting.
All right, Amanda, thank you. Now, as you heard in Heidi and Nick's story, the long-term symptoms of COVID range from fatigue to extreme neurological pain. Some health experts have long been worried about the mental consequences.
We could see, for lack of a better term, we could see the storm clouds building. And we've known this from the very beginning.
Retired professor at Northwestern and psychologist Dr. Mark Reineke is treating COVID long-haul patients. Studies estimate roughly 10% of people who get COVID have long-haul COVID. Now that the country has made progress in addressing the physical components of the disease, he says there needs to be more emphasis on the long-term consequences.
And so there's at least 3 different groups of very specific individuals who are having difficulty adjusting to the long-term effects of COVID. And that doesn't let it go. That doesn't even touch upon those who have had relatives or friends or family pass away, or have lost their jobs, or their corporation, their businesses collapsed. There's all manner of long-term consequences of COVID that we're going to have to contend with for years to come.
Dr. Reineke points out that there's a lot of research being done on COVID long hauler, but it's really scattered at this point. Now, talking to us and in a Chicago Tribune op-ed, he proposed some solutions, including a national COVID response office to coordinate the development of evidence-based programs to address the social and emotional consequences of this pandemic, opening community-based centers to treat chronic COVID conditions, train medical professionals in evidence-based care of psychological and social consequences of COVID-19, as well as making sure that chronic COVID and PTSD patients and children who had the multisystem inflammatory syndrome have a mental health provider. Now, all of that could help prevent some of the worst stories that we've heard of COVID long-haul patients ending their life. A poll about long COVID from online support group Survivor Corps found that nearly 18% of its members who answered said they had thought about suicide.
One is the installation of hope, a sense of a positive future that is out there. The notion that it may be different than the way your life has been in the past, but it can be positive.
Now, if you or someone you know needs mental health help or is considering suicide, the National Suicide Prevention Hotline is right here on your screen, 800-273-8255.